Healthcare today is juggling immense challenges, isn't it? Overwhelmed systems, strained patient connections that often feels like we're constantly fighting upstream. How do we really improve quality, access, and care in such a complex environment? Our deep dive today unpacks a fascinating perspective paper, Transforming Healthcare with AI, Promises, Pitfalls, and Pathways Forward. And our mission is basically to pull out the crucial insights on how artificial intelligence is reshaping medicine just for you.
Yeah, and it's a really good paper for this because it offers such a balanced view. It really emphasizes AI's potential to, streamline tasks, enhance patient care, and maybe even help with physician burnout. But it also keeps hammering home this human-centric approach, which
Yeah.
is critical.
Okay, so where does the paper say we start tackling the existing problems with AI? It seems to zero in pretty quickly on admin, right? The administrative burdens, which frankly are just staggering. I mean, get this. The paper says for every hour a doctor spends with a patient, they're logging nearly 2 hours on electronic health records and paperwork.
2 hours, that's incredible.
It's not just inefficient, it's a huge driver of burnout.
Absolutely. And this is exactly where AI could step in, potentially. The paper talks about reducing that documentation time. Think AI virtual assistants, chatbots handling bookings, insurance stuff.
Right, freeing up clinicians to actually do the caring part. How much time could that realistically save, do you think?
Well, the potential is significant, and that leads into the really fascinating clinical side. The paper delves into AI's direct clinical functions, using what they call clinical decision support systems, or CDS.
Like diagnostic co-pilots?
Sort of, yeah. These systems can analyze just huge data sets, medical records, imaging, labs, and give evidence-based recommendations for diagnosis or treatment. And in some fields, like radiology, the paper notes AI accuracy is sometimes right up there with, or even better than, human clinicians.
Wow. Okay. And beyond just, efficiency, does it touch on the human side, the doctor-patient relationship?
It does. Indirectly, it suggests AI can actually benefit that relationship. By freeing up time, doctors can have more engaged, empathetic interactions. There's actual research cited showing AI tools, like medical scribes, lead to more face time with patients and better satisfaction scores.
That makes sense.
And it's not just big city hospitals. Think mobile health apps powered by AI. They can deliver vital services remotely using machine learning, wearables.
Bringing care closer through the phones we all carry anyway, it feels like healthcare catching up a bit.
Exactly. But it's not all smooth sailing. The paper is clear about the obstacles.
Right. So the pitfalls, I mean, you mentioned trust earlier. What about that?
Yeah, trust is a big one. Specifically, algorithmic bias. This is a thorny issue. AI systems learn from data, and if that data isn't representative, the AI can end up, perpetuating biases based on race, gender.
And they have examples.
They do. A really stark one involved an algorithm meant to prioritize patients for extra care resources. It actually showed racial bias against Black patients because of how the training data was structured, or rather, what it used as a proxy for need.
Oh, that's concerning.
It really is, and it just underscores that human judgment. It has to be the final call when there's a conflict with the algorithm.
So bias is one major challenge. What else? Integration, cost.
All of the above. Integrating AI into existing, often old legacy systems is tough. It's expensive, and there's cultural resistance, too. People are used to doing things a certain way. The paper mentions the Mayo Clinic, actually, where AI scheduling tools hit roadblocks because they just weren't integrated well enough into the workflow.
Right. The tech has to work with people, not against them.
Precisely. And then there's the whole data privacy and security angle. It's critical. AI needs vast amounts of patient data to learn effectively. And there have been high-profile cases, like Google's DeepMind accessing millions of identifiable UK patient records from the NHS.
Without proper consent controls, right?
Exactly. It just highlights the absolute need for robust safeguards, strong ethical governance around data.
So it really sounds like the workforce needs to adapt, too. New skills required.
Definitely. The paper emphasizes that AI demands new skills, data literacy, knowing how to use these technologies effectively. It suggests a real shift is needed in, medical education, more focus on digital health, AI training, preparing future doctors and nurses.
Makes sense. You can't just drop this tech in without training.
No. And that ties into the need for clear ethical frameworks and just ongoing research. The paper lays out some key principles. Transparency, understanding how AI decides. Accountability, knowing who's responsible if something goes wrong. Equity, designing AI fairly from the start.
And respect for patients, presumably.
Unwavering respect for patient autonomy, yes. They point to models like GDPR in Europe or the FDA's approach to medical devices here as valuable lessons.
So wrapping up, the paper isn't saying AI is the enemy or the magic bullet either.
Not at all. It really calls for a balanced approach. Keep researching, implement strategically, and crucially, combine human expertise with AI. It's about augmenting, not replacing. That synergy is key for the best patient care.
This deep dive really shows that AI in healthcare isn't just some tech upgrade. It's fundamentally about redefining how medicine is practiced and hopefully enhancing those crucial human elements, the empathy, the understanding.
Absolutely. The path forward needs constant vigilance on ethics, on inclusivity, and just a profound respect for that patient-caregiver bond. Which leaves us with a big question, really. How do we make sure technology and human compassion truly work together to build a healthcare system that's more efficient, yes, but also more empathetic and equitable for everyone?